Dr. Turner,
Hello.
good to see you again. Something we've never talked about before, I didn't even know about, so I'm going to learn something today along with the audience. We're going to talk about perimenopause, a topic that's new to me. So let's get the definition of terms. What is perimenopause, and how is it different from menopause?
Okay. Menopause is defined as a medical definition of that part of a woman's life 12 months after her final menstrual period.
Okay.
So you get 12 months for the clock to start. 12 months after the final menstrual period, you're in menopause.
All right.
Perimenopause is a lay term that is adopted by medical organizations such as the North American Menopause Society and similar organizations about the time period before that. There are other organizations that are a little bit more specific about what perimenopause is and whether or not it's actually a real medical term. Another term you may hear is menopausal transition. But for our sake, perimenopause works great in discussing this among lay people.
When does perimenopause start and how long does it last?
For most women, perimenopause is that time in her life when she begins to see any of several signs or symptoms. And that can be anywhere from 5 to 7 years before the final menstrual period. Those signs and symptoms can include lengthening of the cycle or shortening of the menstrual cycle, lengthening the number of days that flow or shortening the number of days, lengthening or increasing the quantity of flow or shortening the quantity of flow that you have with each menstrual cycle. You can have mood swings, irritability, emotional lability, any of those things that just weren't normal and predictable in your 20s and 30s and now begin to show up in their 40s can be described by some women as perimenopausal.
You may have just answered it just now, but just in case you didn't, what are the symptoms of perimenopause?
The symptoms that people ascribe to perimenopause include changes in your menstrual flow, and that can be duration, the time from the start of one period to the start of the next one, either shortening or lengthening.
All right.
The duration of the menstrual cycle, either shortening or lengthening. The quantity of flow, hygiene products that you use during that time period.
Right.
Increasing or decreasing. That addresses changes in the menstrual cycle. Inside, between the menstrual periods, you can have mood swings, irritability, emotional lability, difficulty concentrating, remembering the 14th item on your grocery list. There are some things like that where mentally you just may not be quite as sharp.
All right. And how do you know when you've gone from perimenopause into menopause?
The definition is 12 months after the final menstrual cycle. Then you're menopausal.
All right. Do you as a clinician, and can you as a clinician, diagnose perimenopause, and if so, how?
It's hard to diagnose perimenopause in that time frame because I like to listen to what my patient is telling me is bothering her most. Now, if you want a blood test to see how close you're getting to it and you're concerned about having more babies, yes, I can go with a blood test like FSH, follicle stimulating hormone. Now, that gives me an idea of how much longer you have if you want to have another child. Remarry, new husband, y'all want another baby? Hey, yes, that's a different question. So I approach my patients with the first question is, what do you want about future childbearing? Yes, you can get pregnant in the perimenopausal time period. You get a good egg and the right timing and the right environment and everything rolls out, and yes, you can have that late in life baby. And there are a lot of people in our audience who are walking around as late in life babies.
I'm a father of one. So you answered the question, can a woman still get pregnant if she's experiencing perimenopause? And the answer is yes.
Yes. Contraception is a big component in that discussion that we physicians have with our patients, we practitioners, yes.
How does a woman know if she's experiencing perimenopause or something more serious than perimenopause?
Usually it is not something more serious. Most of these things are handled routinely and easily. There are some easy lifestyle changes that you can make going into this. Plenty of exercise, healthy lifestyle, cutting down on your cigarette smoking to stopping, moderation in alcohol if you drink at all, a low glycemic index diet. We in East Texas love to eat. Unfortunately, we don't do it healthfully. Okay?
Right.
So I would recommend, my favorite just because it's everywhere, is Weight Watchers. You find Weight Watchers, you find what weight you want to be, you dial that in and live that the rest of your life. If your magic number is 160 pounds, you go back in for that and you live that way the rest of your life.
You, once again, may have segued into this question. What are the treatment options for perimenopause where symptoms are present and causing difficulty?
I came back to the first question about what she wants for future childbearing. An easy, effective, predictable treatment option is starting on birth control pills. A low-dose birth control pill, especially if you're a non-smoker. If you're a non-smoker, I can give you regular predictability. You remember that time in your life when you knew exactly what time on Tuesday afternoon your menstrual cycle likely to start with your favorite birth control pill? I can get that same thing achieved with the low-dose pills that we have now. And if you had a favorite 5-10 years ago, I can start you back on it again. That gives predictable hormone levels. It stops the ups and downs, the fluctuations that are usually what most people don't like. They don't like the surges. They don't like the drops. And it's that change from one hormone level to another, either up or down, that usually wreaks havoc with most women.
Okay. And once again, you may have walked us into the answer to this question. Are there things a woman can do besides medical treatment to reduce the symptoms of perimenopause?
Diet, exercise, lifestyle. If you want to try some of the over-the-counter products to see if it makes a difference, I'll let you try that. Those are simple. Usually they mostly help you get in the frame of mind that you're going to conquer it. Relieving stress in healthful ways are beneficial. I can't overemphasize the importance of healthy diet and healthy exercise and good sleep habits.
Well, you mentioned something just a moment ago, so let's amplify on it with respect to diet. Low glycemic index diet. Give us a little color on that, a little amplification.
Almost all the recent diets that have come out geared toward women, such as Weight Watchers or The Zone or South Beach or Carbohydrate Addict Diet, any of those things are trying to get us to cut back on our high-density carbohydrates.
Okay.
Chips, yes,
Right.
that's right. Cakes, donuts, high-density carbohydrates. The low-density carbohydrates are most fruits and vegetables. There are very good indexes that you can go to on the internet. You can just type in low glycemic index foods, and that'll give you an idea. And the low glycemic index food is how the body takes it from the mouth, processes it, and then gives you your rise in blood sugar.
Right.
A nice, slow, steady rise in blood sugar over a period of an hour, over several hours is good. The real spike is not good. And that's why you have a high-carb breakfast at 7:30 and 10 o'clock you're crashing.
Right.
You had a high glycemic index breakfast. Eat a healthier breakfast.
Very well. Doctor, thanks for your time.
Okay.